Well, here we are again for COVID status report, now number 20, and the title of this is Solutions. My name's Ty Newell, and this is being posted July 6, 2020. This virus relies on our stupidity, and we've been very, very stupid, so it's having its way with us. Finally, others are catching on. COVID-19 is airborne. One article from April 7th, indoor transmission of SARS-CoV-2 was a study in China. One of the individuals is a faculty member at Tsinghua University in Beijing, and I show a picture of here from Tsinghua along with a similar picture from the University of Illinois. And a little over 100 years ago, an international visitor to the University of Illinois, one of the earliest architecture schools in the U.S., the visitor from China went back, enjoyed our campus so much that on Tsinghua's campus decided to emulate that, and here you see one of the results. I've had the pleasure of giving a lecture at Tsinghua, and it truly is one of the world's great universities. This study points out that out of 7,300 cases in which the authors were looking for outbreaks, and they defined an outbreak as 3 or more related cases, that they found a little over 300 outbreaks among 1,200 of the 7,300 cases. 80% of the outbreaks occurred at home. And in the home infections, about 3 to 4 cases per outbreak, about what you'd expect. Basically, everybody in the house got sick. And while large gatherings were, say, less than 20% of the outbreaks, large gatherings such as shopping, restaurants, that these outbreaks were the larger number of cases per outbreak, numbering somewhere in the range of 8 to 9. And basically what this is telling us is that somebody goes out, is not careful, they're infected, and they tend to infect then maybe 8 or 9 other individuals on that outing. Those individuals go home, and then they infect 3 to 4 people. So multiply 9 times 4, you end up with 36 cases as a result of one person going out and getting others sick. Now, what's also notable from this study was that only one outbreak, but it wasn't included in the investigated outbreaks because it only had 2 cases. Only one outbreak among the 7,324 cases occurred or was identified as having occurred outdoors. If you can get outdoors, if you can't get as much fresh air as possible indoors. The second paper just published June 30th, but I wanted to mention Professor Mario Molina and colleagues. Professor Molina, some of you may know, is a Nobel laureate who was one of the key investigators who defined how freons were destroying the ozone layer. And in this study, they did a very detailed statistical study of epicenters in China, Italy, and the US, and looked at similarities and differences such as face masks, social distancing, and isolation in order to determine that airborne transmission is the dominant route for the spread of COVID-19. Then third, a recent article in the Harvard Gazette, is air conditioning helping spread COVID in the South? And a talk was given by Professor Edward Nardell of Harvard Medical School, an international scholar in airborne disease transmission, and especially in tuberculosis. And Professor Nardell makes a comment, among others, in his talk that COVID 19 appears very similar to tuberculosis in its ability to be transmitted by airborne mechanisms. And he states, as people go indoors in hot weather and the rebreathed air fraction goes up, and rebreathed air fraction means carbon dioxide concentration goes up, the risk of infection is quite dramatic. Finally, 239 experts, and as you may be hearing on the news or reading in the New York Times or other newspapers, that they have written a letter to the CDC and the World Health Organization stating that the coronavirus is airborne. It's about time. We've been saying this for 3 months. People are dying. We need to get control of this thing. And I've been making a bit of news locally as they quoted a recent paper I wrote that we're facing an infection tsunami. And so if you look up this article, you can read it in more detail, but it's basically what we've been talking here for the last now 3 months. Let's look at the infection parameter trends and then the current state within the US. We'll come back to the international situation in another talk. But this infection parameter that I go on and on and on about, the ratio of how many infections per infectious person are occurring. And mathematically, this needs to be below 2.7 for infections to die out. The further below we can get, the faster they die out. But as I showed in this plot, I haven't changed except for adding new data. I made 3 weeks ago. This shows that I was projecting that sometime around the beginning of July, the US would be going positive. I didn't expect such a dramatic jump, but that is why we are seeing such rapid acceleration of new infection cases. And right now we are at an infection parameter of about 4. That is 4 new infectious cases over a 2-week period per infected person. And as bad as it looks, I want to give you hope because we're not that far from controlling it. Just looking at these plots we've made over the last 3 weeks in different states, and again, I haven't changed the plot or the lines, just added new data. Florida continues screaming up to higher levels of infection parameter. North Carolina, relative to this line that I initially drew through their data, is actually kind of leveling out and doing okay. California is accelerating above the line I drew, not as extreme as Florida, but definitely getting more and more out of control. When we look at New York, I had projected that maybe somewhere in August, the latter part of August, they would start accelerating in cases, growing new infections per day. It looks like they're doing that earlier. And as we've discussed, the onset of hot weather, forcing people indoors, inadequate ventilation, inadequate air filtration, these are causing the rapid spread of COVID in the indoor environment. Georgia is jumping up high. It's hot, it's humid. Again, this is breeding the virus, allowing the virus to be transmitted more efficiently indoors. Washington continues to struggle, no discernible trend. The weather not so hot there as in other parts of the country, but still it's just tough to get control. Ohio and Minnesota, where they had been able to get below the transmission growth line, the 2.7 infection parameter line, they both jumped up. Minnesota, less so than Ohio, but it's not as hot, not as humid, so perhaps a bit more outdoor activity, a bit more open windows in Minnesota. And Illinois and Michigan, unexpectedly, but again, most likely due to this surge in heat humidity we're experiencing, has gone above an infection parameter of 2.7, and are both seeing a growing number of cases per day. 3 weeks ago, I made this plot, and the 3 lines on this plot, if we perfectly isolated as of this date back in June, if we perfectly isolated, then we could drop down to 0 infections, 0 cases. We'd be done with it. This thing would be dead. It would be gone. But perfect isolation, a 0 transmission efficiency parameter is just out of our reach. This other line, which was the trend we were on, where we had an infection, a social distance index of about 30 with an infection efficiency, transmission efficiency of about 10%. If we could have held the line and kept the transmission efficiency down, we would have died down to less than 5,000 new infections per day. And then this wave, the so-called fall wave that I projected, indicated a drop in social distance index from 30 to 20, while still maintaining a low transmission efficiency of 0.1. And transmission efficiency is made up of face masks, distancing, sanitizing surfaces, increased fresh air, increased filtration, using ultraviolet, and then, as we're going to discuss, some additional smart ways to break the chain of infection. But if we could have followed that, and then as schools opened up, allowed for some backsliding, going from a social distance index of 30 to 20, getting closer, interacting more, kicking us up above an infection parameter of 2.7, but then regaining control by either distancing or redoubling efforts to get transmission efficiency down, or both, we could have gotten that thing to decay. And the difference between this path that we're on and this one is a difference between 20 million infections or about 1 million fatalities. It's inexcusable if we follow this path. Well, that was 3 weeks ago. And even though I saw that we were getting off of this path and moving on to this one, I was hoping we wouldn't. But then 2 weeks ago, I showed you this slide, and the data started percolating up along my predicted path. Last week, I showed you this slide. It's continuing its progress on that path. And here's this week. It continues to follow this progress. This new path I've plotted indicates if July 2nd, we kept about the same transmission efficiency, about a 22%. And that's about where we're at right now. And that is indicative of the level of face mask. But remember, 1 person out of 20 that's not social distancing, not wearing a face mask, not being safe, is the difference between this being 20% and 10%. We need to get the number of unmaskers, the number of people cheating on social distancing down. We need to get everybody on the same page. This, if we would distance back from 30 to 40, a little bit more isolated, but not as isolated as we were, so still open and interacting, we could follow this path. But July 2nd has already passed us. So let's talk about what we have to do to control, where we've been and where we need to get get below this line. This plot is just an enlarged version. This is an enlarged version of this plot. Originally in March, we started up here with an apparent infection parameter of about 60. For every infectious person, that over a 2-week period, about 60 more infections were showing up. As we went into isolation, because we took it on ourselves to isolate, not because there was any coordinated direction for us to, We isolated quite rapidly over a couple week period and got up to a social distance index of about 60. Remember the social distance index, this is an independent parameter produced by the University of Maryland's Transportation Institute. And so it correlates very well. This red line, which I use as a reference line for what normal interaction at different social distance levels based on this University of Maryland parameter. We were up here, we isolated, and then as we started to reopen, we started following this path. These other lines represent transmission efficiency levels of 60% relative to our normal interaction line that I define this with of 100%, and then 30%, 20%, and then a parametric infection transmission efficiency of 10% down here. So we followed this path, and then we started reopening, and this enlarged view shows us once we started going back, we were largely staying underneath this 2.7 boundary and seeing some decrease in new cases per day. And then we started following up this 20% transmission efficiency line. And we've been kind of diddling around as it's moved around to different states with, as we saw, different levels of infection parameter. But basically, we're right around here and have been for the last couple of weeks. Now, to get below this, if we backtrack to a social distance index of about 40, while maintaining roughly a transmission efficiency of 20%, so not going all the way to 60, and actually New York got to 70. So this isn't that high compared to what New York was able to demonstrate. But if we get to 40, while maintaining good protocol in masking, staying 6 feet apart, getting more fresh air, all of those things that contribute to a lower transmission efficiency, we will get to a level, an infection parameter of about 2, and good things happen. We missed the window for July 2nd. July 9th is coming up. If we don't make July 9th, if we get on that path and get serious by July 16th or 23rd or 30th, but if it takes until the 1st of August to really catch our attention, we're going to be at 400,000 infections per day. We're on our way to 100,000, as Dr. Fauci has said, and because of the dynamics of this, because of the steamroller momentum, as we've discussed, we needed to take action here to be able to take this path. We need to take action now in order to hopefully hit this path. And the difference between these is a difference between 20 to 30 million infections with about 1 million deaths versus getting this thing snuffed out with maybe 5 million or so infections and maybe a couple 100,000 fatalities. Let's talk about some solutions for outsmarting SARS-CoV-2 virus. It's not smart. It has no brain, just like our government. So we can do some things to outsmart it in addition to the brute force masking and social distancing, getting fresh air, and putting improved filtration and possibly incorporating ultraviolet germicidal irradiation. One idea from Uri Elan of the Weizmann Institute, and you can see this in a COVID TED Talk, is smart scheduling. Break the cycle. 4 days on, 10 days off, and test before you return. So if we down below look at 2 simple groups, but these can be multiple groups that are going through this kind of scheduling. But let's say group 1 works Monday through Thursday, or goes to school Monday through Thursday on week 1. And then for the next 10 days, Friday through Sunday the following week, That's enough time for the 7-day incubation period, and then time to be infectious, where at the end of your 10-day period, you get tested, and everybody who tests negative can come back to work in the next work period. But in the alternate week, group 2 shows up. They work Monday through Thursday, maybe 4 10-hour days, and then they have 10 days off. Or perhaps in a school, this way keeps the occupant density down so that you can have more fresh air per student and hopefully keep below 800 parts per million of CO2 concentration if you're unable to do this by increasing the ventilation level in your school. But this is a very clever idea. It's one that should be very, very effective. It keeps things functioning, although in an altered manner. But this is, I think, a very good idea for breaking the chain of transmission while not breaking the economy. The Navy has published guidelines that they use for forming bubbles on ships. And after their initial outbreak on the aircraft carrier, destroyer named the USS Kidd had an outbreak, and they used this to quickly contain, to identify infected persons, to isolate, and then to keep functioning in these uninfected bubble groups in which one person then is assigned to be the one who interacts with this other bubble or with that bubble, but in a manner that allows them to logically control if an infection does occur again, as well as track if one occurs. And then just food for thought, the open air school movement in the early 1900s, they knew that disease is in the air, especially tuberculosis at that time. And so there was a very strong movement to be outside all the time, the middle of winter. So something to think about, and as much as you might be able to do that, although this day and age, as um, uh, with the prevalence of asthma and allergies, that as well as security, as my cousin and his wife, who are school teachers, alerted me to, that we've got other difficulties in addition to fighting this thing to consider. So I'm continuing to be a broken record. It's a 5-alarm fire. We haven't begun to extinguish it yet, but we are so close. We can reverse this infection growth. And even though this thing is not going away in warm weather, and we are making situation worse by putting ourselves more and more in poorly ventilated buildings as the heat and humidity propagates through the country, we can handle this. We're not far away from getting this to decay again. Certainly not as far away as we were before. And remember, as horrendous as 25 million infections in the fall without controlling this thing through July sounds, that is still just the beginning. 200 million or more infections is where this is going to head if we don't get control now. Continuing on our warnings, just stay away from unmaskers. You don't need to challenge them. It's just going to create other difficulties, but just shun them, just stay separate, and keep your space. Our support and thanks to essential workers and medical staff. I'm so sorry that through our careless acts that we're straining you beyond what you ever thought might happen. I hope we can get things in control and keep you safe as well.